The COVID-19 pandemic has presented multiple opportunities for change in American societal infrastructure, especially considering the U.S. has the worst rate of infection and death per capita in the world, the last I saw. And of course, we're mainly concerned, but not only with the healthcare infrastructure, as we continue to push for national improved Medicare for all. But with the recent events with law enforcement, caused deaths of African Americans, George Floyd in Minneapolis, Breonna Taylor in Louisville, and Manuel Ellis here in Tacoma, hashtag Black Lives Matter has again opened up discussion of racial equity or lack of racial equity in healthcare, as well as equity in education, housing, jobs, livable wages, and social justice, of course. Other important issues opened up by the pandemic in our healthcare infrastructure are supply chain issues of medical equipment production, particularly personal protective equipment and ventilators, which are largely produced and manufactured in offshore places like China and India with non-union labor. But we can save those issues for future monthly meetings, hopefully. Another important issue opened up by the pandemic is labor relations in general. And in today's discussion, the exploitation of largely underpaid and unsupported medical inpatient house staff who bore the brunt of providing inpatient care, often without the support staff needed due to cutbacks in staffing, and also with lack of personal protective equipment. You may have seen at least three that I know of, full-page ads in the Seattle Times, accentuating these issues with house staff. So we welcome here to talk about this Brenna Stroup, who's the Executive Director of the University of Washington House Staff Association. Brenna's bio was nicely laid out in the flyer you all received for this event. So I'll just let her add any other identification needed. And I guess we're going to have questions. She will entertain questions in the midst of her presentation, so we don't have to wait till the end if people don't want to. Okay, Brenna.
Yeah, my name is Brenna Stroup. I've been with UWHA for just over a year. And I am not a resident. I don't have a medical background, but I did federal policy in DC for nonprofits, and then moved back to Seattle and kind of fell into this job, having gotten some labor experience there. So I want this to be really casual. If you have questions, definitely please just ask them throughout. So we can start on the second slide. So many of you probably have experienced a lot of these same things that we are fighting for still today. And the biggest reason why we need labor unions in our residency programs is that we just need this united voice together to fight back against our employer for the things that are just not good working conditions. So the biggest thing, and I'll go through kind of, you'll see later on in this slide, some kind of like timeline about how we started and where we are now. But some of the biggest things that we are working on, collective bargaining is a huge part that we would not be able to do with a labor union. So it allows us to have the legal power to push back against the employer. It also helps us establish benefits and contracts that help these things stay through time instead of losing them in between years. This is a little bit different for us versus other unions, which I will talk about, but there's potentially a lot of national and local resources that you get by being part of a labor union. And it also allows you to have representation on certain committees that we wouldn't otherwise have. So currently, as part of our contract, UW is required to give us certain seats on committees and make sure that residents have voice when those decisions are made in those committees. So that's really helpful to us as well. And then just being a part of a larger group like this, there's a solidarity that we have kind of the backing of other labor unions at UW. So UW has 22 unions across the institution, which is a lot. And anytime that we have issues, we know that those other unions are willing to go to bat with us as well, and that's really powerful. and something we're really trying to build more on as we are around for longer, since we're still a pretty young union. And then one of the other things that is really important to us too, in having a labor union, is having this sustainability. So when I talk about the history of UWHA, you'll see later on that there is obviously a lot of turnover because people are only residents for a few years. And so having a group that is concrete, that has staff that's able to stay through, really allows us to be more sustainable in the long run, and we're able to keep building instead of rebuilding this wheel over and over again each year. So I'll move on to the next slide. So you'll see the one that says labor unions for residents. So we are unique in that we are an independent labor union, but the Committee on Interns and Residents, CIR is what they're known as, is a national residency union, and they have been around for quite a while. They were legally recognized in 1957. And they are the largest and oldest residency union in the country. So they are really the go-to people that most people, if residents are thinking about unionizing, they generally go to CIR first. They have about 17,000 members, and they represent over 60 hospitals across the country. So they have unions in basically every state. And they're just like represent the majority of people. And then there's a few other groups that are similar to us that are independent. So UC San Diego is an independent labor union, as well as University of Michigan, but University of Michigan has been independent for a long time, and they just announced that they are going to be joining with the Federation of Teachers in Michigan. So they're going to switch over to being part of a national or a state union soon. So there will only be 2 of us that are in this independent labor union position. And then you can also, residents can join any union. If they don't want to go with the national or they don't want to go independent, they are welcome to join any union that's out there and exists. And that is somewhat common, but it just kind of depends on where residents are at and what they're going for and what the most powerful union in their state is. And I think we get this question probably more than any other question is, why are we not members of CIR and why are we independent? And I've kind of outlined some of the main differences on this slide, you'll see, but the dues are substantially different depending on what type of union you're in. So ours are only 0.5% of people's salary, which is extremely low. So an intern this year will only be paying $11 a paycheck. So they very, very easily will make back their money. But with a national union, you do pay much more. So CIR, for example, is 1.6% of your salary, but that also means on the flip side that you have higher staff capacity, potential for political power as well. So our union at UWHA only has 2 full-time staff members versus CIR has 60. So they're obviously able to do a lot more in the terms of like political stuff that they're working on. They have people that they're totally focused on that versus we do that, but we also have everything else to cover as well. And then the other big difference, which I think is another reason why we have chosen to stay independent, is we at the end of the day have all the final decision-making power. So when we decide to do escalations or do things like run the ad in Seattle Times, we get to decide that, and there's not this bigger organization that we have to answer to. So that does influence, I think we feel like at UW that we have to push a little bit harder than other places have to. And so CIR might not necessarily be open to us doing some of the actions that we did this year. In fact, we know that they haven't been at other institutions. So that's kind of been a reason for us to step back. Yep, go ahead.
Yeah, are you a closed shop? Does everyone have to join the union?
Everybody does not have to join a union. So based on the Supreme Court decision a couple of years ago, it is totally voluntary, which is unfortunate because it means that people can choose to not be members and pay dues, but they still get all the benefits, which is, we have about 82% of our residency program are dues paying members, which is really good, and we're proud of that. We are actively trying to increase that, but if people don't want to be part of it, they don't have to be. Okay, but they still get, like, the contract is still totally relevant to them. All right, so I will skip on to the next slide. So this, I'll just kind of go into a little bit about us specifically. So we represent 1,400 residents and fellows that are employed by the university or by UW Medicine. And that's about 20% of doctors in King County. So we actually represent a pretty large amount of people in terms of kind of demographics. And our residents are spread out between a lot of different hospitals. So you'll see UW Medical Center, Harborview, the VA, Children's, UW Northwest, which UW just was able to get recently, and any of those kind of like neighborhood clinics that exist around the county. And as I mentioned, we are one of only 2 independent labor unions, independent residency unions in the country. And we are the only unionized residency program in Washington. So we are kind of getting to call the shots and be out there, which is really exciting. And we are hoping to inspire more residents in our state to hopefully unionize, especially as like WSU has created a residency program too. We're hoping that they will join on as well. So we know that we're more powerful, obviously, if there's more people who are in the same position. And our mission is pretty straightforward: to advocate for the medical and dental trainees of the University of Washington and affiliated programs in matters of their employment, working conditions, and development during training. So I'll move on to the next slide. All right, so this one's called The History of UWHA. So our organization has actually been around for quite a while. So UWHA first started in 1964 as just kind of like a general nonprofit that was focused on residency needs. And during this time, there has been a lot of kind of ups and downs, and our organization tried to unionize 4 different times throughout its history. And obviously, I'm sure many of you know that starting a union is incredibly difficult. It is very difficult when you're working with people who are working 80+ hours a week. And the University of Washington did not want residents to unionize. So they actually were able to stop it multiple times. So you can see on here, they attempted to unionize in 1974, in 1981 as well. I've included a little picture there from the Seattle Times in 1981 when they tried to unionize, and there was articles about it, which we recently just found these, and we're really excited to kind of see the full history of where we've been. And so in 2014, we had a group of residents who were especially inspired by all this, and we're just like, we're going to change this. And so they actually went to the Washington State Supreme Court and fought it at the state level, and were able to get residents to be considered employees instead of students. And that was the thing that flipped it for us. So we were finally recognized in 2014, and then they started bargaining the first contract from there soon after. And that first contract is always the hardest, and it took 22 months for them to get to a final contract. So it's good kind of perspective for us as we just went through the last 11 months of negotiating to remember that they spent twice as long as we have in this last round of negotiations. So it's been a long battle, to say the least. So I will move on to the next slide.
Quick question. Have you guys won a new contract yet?
Yes, so we actually got a contract we signed last Tuesday.
All right, congratulations.
So, thank you. It's not the contract that we all want, so it's kind of been, it's bittersweet, to say the least. I think people are tired, but well, I'll get into that too, but it's nice to just kind of be able to like move on to the next step a little bit. So the next slide is, as a labor union, what does UWHA do? So we actually do a lot more than I think a lot of people realize. So obviously we do negotiating the contract for 1,400 residents at UW. But one of the other most important things that we do now that we have this contract is that we hold the employer accountable to it. So this means that we are constantly asking people to reach out to us if they have things they think are in violation of the contract, and we file grievances for them, which can be an incredibly long process. Sometimes it is as easy as just talking to the program and saying like, hey, this is a violation. And sometimes it can just be something that people didn't realize and is accidental. And then sometimes it is very intentional by the employer, that they're trying to find little loopholes. So we've also had grievances that we've worked on. There was one we just finished up that we had originally filed in 2018. So it's kind of all over the place, but is really important. And this is like where being a labor union is especially important. It gives us the legal ability to fight this. And we do have a lawyer that we work with as well for this. And then we also have additional benefits, that some of which are part of the contract and some are things that we just add on. So we have a child care fund and a grant program, and I'll talk about these a little bit more too. But these are the things that we do extra to try to help make UW more equitable for residents that are coming in, so it's accessible to people who may not come from as privileged backgrounds. And then one of the things that we worked on a lot in the last year is, as I mentioned, there's all those other unions at UW, and there are a million unions in Seattle and Washington. We have been really trying to build our relationships with those unions so that we can promote better working conditions across the board. So for example, UW is closing one of the psychiatry units at UW Medical Center right now, and so we are working with the nurses union to try to push back on that. And we will have our residents go and speak at different things too. So when they were furloughing the staff at the cafeteria, we sent residents over to speak on behalf of them to say, you know, we have to eat in order to do our jobs, and so we need this staff here too. It's this whole cycle of, we just need everybody to be part of it. We can't do our jobs if there aren't people cleaning the rooms and feeding people and all that kind of stuff. So building those relationships makes us much more powerful as well. And then let's see what else. So we also represent residents who may have some type of disciplinary situation. So we are not there to get people out of, if they do something wrong, we can't, you know, magically get them absolved from that, but we are there to make sure that they are treated fairly and equitably during that process, so that they're not treating some people better than others or letting people go when they didn't hold other people to the same standard. So if any resident, regardless of if they pay dues or not, if they reach out to us and ask for union representation in these meetings, then we will be there for them. And then we also do some of the kind of more fun stuff, like we organize the escalations that we need to do to put pressure on the employer during contract negotiations. So I'll talk about this a little bit more later on too, but we organized a walkout. We also had a wellness day, which is the equivalent of like a sick out. We did things like the Seattle Times ads and stuff like that. So we kind of plan all that stuff behind the scenes and then get residents to actually show up. And then we also do kind of fun stuff like, you know, we have membership engagement events and remind people that being part of a union is actually really great and cool, and it's not like something of the past. And then something that we are starting to work on a lot more is our political engagement work. So initially when the union was started, there was no staff, and people were doing all this on top of their jobs. And now that we have more capacity and have a bigger board and staff members, we are looking into different issues that impact not only our residents, but the patients that they all see as well. So we know that if somebody comes into the hospital and they are being discharged, but they don't have a home to go home to, then they're more likely to come back to the hospital. And so we have been looking into different things like that. And I'll talk about some of the kind of campaigns that we've joined on to, but we're trying to think a little bit more intersectional and not just what's directly in front of us on a daily basis. So I'll move on to the next slide. Again, the next one is what we continue to fight for. So this is where it'll be a little bit depressing, and you probably know a lot of these things already, but UW trainees make about $5,000 less than residents at institutions that are in comparable cities based on cost of living. But we are the lowest paid residents in the country by cost of living. And that really has a lot of impacts on recruitment, and I'll talk about this a little bit more as well. But a lot of residents actually make less than minimum wage per hour. And the way that this is able to happen is that it's been written into policy that residents are exempt from minimum wage laws. So if you're coming in and working 80 hours a week and you're making, you know, your first year salary, you're going to be making less than minimum wage, and that has a lot of consequences. We also, before we started bargaining this contract, we actually received less vacation time than 75% of peer institutions. So before the contract was bargained, there was only 3 weeks of paid vacation. We were able to win an additional 3 days this year, starting on July 1st. And in 2021, we will have 4 weeks. So that was probably the biggest win that we got in this round of bargaining, but also just has a lot of consequences for people's downtime. So people are burnt out. They need that extra time to have off so that they're giving the best patient care that they can. And then when we are looking at all the different things that we're bargaining for, there's a lot of kind of added things that other institutions do that help to make it more livable. So a lot of institutions will pay housing stipends because residents have to live within a certain amount of minutes of the hospitals that they're working at, and hospitals, all these hospitals I mentioned earlier, are really spread out in Seattle, and so it really limits the places that residents can live. So a lot of residents are kind of forced to live in like Capitol Hill, like just really central Seattle areas, which are also some of the most expensive neighborhoods. So we really fought hard to increase the housing stipend this year, which we made a little bit of progress on, but is still an amount that is less than what most residents probably pay for 1 month. So definitely does not cover that. And then we also fight for things like additional childcare financing, which the university doesn't, they did not increase this year, and they actually have told us that no other job class gets paid additional money for their childcare, which we think that they should anyway, so it's not the best argument. But we acknowledge that if people are working 80 hours a week, like they're gonna have childcare needs, and that's very expensive in Seattle, so most people spend on average like over $2,000 a month on their childcare. And as I mentioned, if you're making less than minimum wage per hour, that's really hard to make ends meet. So we have fought for things like that. Unfortunately, this year we were not successful in that element. And then we also fight for things like getting parking reimbursed, meals reimbursed, helping with professional development kind of stuff. And we were able to make a little bit of traction on these this year as well. And then as I've mentioned, many of our residents are struggling financially while they're working these 80-hour weeks, 28-hour shifts, and so it's really hard. There's really no other way for people to make money, and they're really at the whims of their employer. And then, as I also mentioned earlier, we are continuing to fight for policy that intersects with the work that we're doing in our communities, and making sure that our patients also have access to affordable housing and education and healthcare as well. And one of the things that we've talked about a lot this year, but we're really putting a lot of emphasis on this as we're going through this movement right now, is that we need to make sure when we are looking through our contract and we're fighting for things, that we're making sure that we're really centering our residents of color and making sure that they have access to all the things they need, and that our institution is equitable, and that we're doing the same thing for patients. So this has been really a time for us to do a lot of kind of self-reflection about the direction our organization is going, and making sure that we're really fighting for everybody, and not just making UW this place that's only accessible to the most privileged people. So the next one, it says impacts for recruitment. I've added a few of our kind of data points that we've shared this year. So when we decide on how much we're going to ask for in contract bargaining, we did a ton of research. We compared over 100 academic centers across the country and really looked at like, what are the peer institutions for UW? What are they paying? What kind of benefits are they giving? And one of the things that became very apparent really quickly in looking at all this and then comparing it to the match data is that as it becomes more expensive to be in a certain place, so as Seattle gets more expensive, and UW does not account for that, the match rates have gone down. So you'll see I included this little graph that has UW's ranking versus cost of living for we did this for the last 17 years, and saw as Seattle became more expensive and salary did not go up, UW's ranking went down. And we also saw with this that impacts the ability to fill residency spots. So more spots ended up being open at the end of each year, which meant that more people were soaping into their residency programs, and we do see consequences of that as well. And then the other one I put next to it is UC San Francisco had a very similar situation to us. And you'll see in those individual years that as they realized this was an issue and they started paying more, the ranking did get better. So there's direct data that's showing the correlation between these things, and we've presented this to labor relations quite a few times, and they don't seem to be too concerned about it, which is even more upsetting to us. But we know in the long run that if these spots remain open, that just means that there's less physicians that will be staying here. People are also more likely to stay in the area that they do their residency. So it's just really disappointing to see, like, we're literally seeing this happen in real time, and it's going to impact the healthcare of our entire, like, the next few decades, as if UW doesn't kind of start to match up to that salary, or the salary to cost of living here. Okay, the next slide says actions we've done this year and some of the campaigns that we've supported. So we started bargaining this last contract on July 16th of last year, so almost a full year ago. And we really know that negotiating happens outside of the negotiation room. So it happens when the employer is scared about what we're going to do. And we really do have all the power. If every one of our residents walked out of the hospital, or even half of them walked out of the hospital, UW would not be able to function. There's really nobody that they can bring in to cover the work that residents are doing, especially at such a low cost to them. So we started really thinking about, okay, how are we going to put pressure? Also knowing that our residents are not used to engaging in these type of activities. So we really worked on this kind of like upwards ladder to get people engaged. And the first big action that we took in bargaining this last year was in September. We did a 15-minute unity break where we had residents all walk out of the hospital at the same time. And we did this across 4 different hospitals. We had over 500 residents who participated in this, which was incredible. Like, nothing like this has ever happened at UW before. And so we had everybody walk out and stand in front of the hospitals, and we had signs, and everybody wore shirts, and we had speakers at all of them. We did a ton of media attention around this. And it was really a huge win, and was really inspiring. And we did a whole kind of week around planning for this to build up for it. So we did a social media campaign that went with it. And then we went into bargaining the next day, and we brought a ton of residents with us. So the room was full of residents who were really ramped up. And that was it was really inspiring to see. So that kind of gave us a lot of hope moving forward to keep pushing. And so we started thinking, how can we push the needle a little bit farther? And we organized this resident wellness day, which is essentially a sick out. We don't call it that legally, just to like keep ourselves safe. But what we had residents do is we asked them to pledge to take off a day of work, like for a sick day. And we had them do this in advance so that they could tell their programs, and their programs could get coverage. So we don't want to, we want to make sure that patients are not impacted by any of our actions. And we think about 300 residents who did that, and there has never been anything similar to that. No other residency union has ever done that before that we're aware of, maybe a couple decades ago, but nothing recently. So that was also a really, really big ask for our people. And I think we will probably do this again, but we'll have to kind of massage the messaging on this. And then the next thing that we planned was having a review of systems boycott. So we had asked people if they would be willing, when they did notes, to only put in the notes, or to only bill for the review of systems that they actually did. And this is another action that no other union has done, no other resident union has done. And we had planned to start that on March 16th and gathered pledges. And unfortunately, that COVID came right around that same time, and we just felt like we could not move forward with that action, and so we postponed it and didn't end up moving forward with it at that time. And then there's just kind of a bunch of other things we've done, like quite a few petitions. We did a ton of media stuff. We were really proud that the lead negotiator for UW actually, in a very not nice way, said that we've gotten more media coverage than he's ever seen any group get in bargaining. So we were really proud of that. So we really pushed that in the Seattle area. We got some national coverage too, and we did those Seattle Times ads as well. And then we asked programs to write support letters. So we got a number of programs to do that, which I think was a big step for a lot of people to kind of go out and kind of like risk. I know in medicine, a lot of people like don't want to do anything that's like risky. And so that was good for us to start pushing that. And then we also were able to get the entire Seattle City Council wrote a support letter in support of us getting a good contract that they sent over to UW Medicine leadership. So something that we were really proud of as well. And then we have been working on a lot of these kind of external things as well, which I think is how we ended up getting connected with you all. But we have done some work around rent control stuff, ORCA for all, so the free transit passes for everyone in Seattle. We have done some work around some of the progressive tax proposals that have come up. We have engaged in a lot of the protests around Black Lives Matter, and we've discussed, so this actually is happening at the moment, but the removal of the police union from the county council. So just saying that we don't think that police have a place in our labor community, as well as supporting the defund the police department work and decriminalize UW and a few others. So we're really trying to look outside our just kind of day-to-day stuff and be like, how can we help and impact our patients to the best of our abilities. And then I will move on to the next slide. So just kind of.
Brenna, can I ask a question?
Go ahead.
So as you know, the purpose of our organization is to obtain national improved Medicare for all as an overall system. And I'm just wondering what the overall sentiment is of the residents on this idea, and if they can actually help out in any manner to move that issue forward.
We have not polled our members on it. I think generally our membership is, I would say, like pretty moderate, or if anything, like a little bit more conservative in their kind of policy stances. But we've really pushed people to think a little bit harder and more critical this year. And I think like we're really moving that way. Our board is definitely in total support of this, and our staff. But we haven't done like a full poll of everybody. I don't think it would be a super hard sell. I think for the most part, people understand why that's important.
Thank you.
All right. So just kind of closing up, I put a couple things that are just helpful to us. But if there are any things, like if you're ever working on any type of legislation or actions, like we really do want to get more involved and be helpful. So please don't hesitate to reach out. We also generally really appreciate if people are willing to put pressure on UW Medicine. So if people have relationships with people who are high up at UW or are big donors or anything like that, we really do ask them to reach out in support of the work we're doing. And this does change a little bit as we're not in contract bargaining right now. And then we've got social media and our website and everything, and we accept donations. So all those kind of things are helpful to us. And I've included all of our social media handles on there as well. But otherwise, happy to answer any questions that people have.
I see that. I had a comment actually to put things in perspective, how awful the situation is now. But in 1953, I was an intern at the Montreal General Hospital, McGill University Hospital, and my salary was the first time they got any salary. It was $25 a month, and I had 2 days off a year. I could choose either New Year's Day or Christmas. And if we wanted to go to get a haircut or go to the bank, we had to get another fellow intern or resident cover our service.
Yeah.
Basically, we were there 24 hours a day. So put it in context. It was just awful, and the
Yeah.
residents. You've come a long way, and I congratulate you for pushing harder. But we still have a long way to go. But it was just unbelievably bad in those days.
Yeah, it's interesting you bring that up because when we did the Seattle Times ads, we started getting emails from all these doctors who were sharing their stories like that with us about like, this is what I had to go through. And I think it was really inspiring to us to see, you know, like there was people who fought to improve it to where we are now. And if we keep doing that, then we can make it at some point more of a humane profession for people. So I think we're really lucky to be able to stand on the backs of people who've gotten it to this point.
Incidentally, I read a little article somewhere that I think it was Seattle Times, that the nurses at the Issaquah Hospital of the University of Washington were furious because of the $500 million the medical school is in debt. They closed down the 14-unit psychiatry ward, and everybody was dispatched. I guess
Yeah.
including the nurses. Do you have much contact with the nurses union? How good are they? How strong are they?
Yeah, we do have a lot of contact with them. So there's two main ones that we work with. There's the Washington State Nurses Association, and then there's SEIU 1199 too. And we do have good relationships with them. Like when 1199 went on strike, we were out there with them. They actually tried to get residents to cover for nurses, and we were like, we're not going to be scabs, and we're not going to cross the picket line. And so we told our residents not to do that. So we are really happy with that relationship. And the psychiatry thing is another thing that we're currently working on with them, because obviously we're all tied together. So we've got their backs for sure.
Yeah. Well, the nurses are incidentally tremendously supportive of Medicare for all.
Yeah.
Healthcare system, particularly the ones in California, have done a superb job. But around the country, I think those nurses are fantastic. They put the patient first.
Yeah, that's definitely true. I see Chris has got his hand up.
Yeah, hey Brenna. First of all, thanks for all you do, and getting that 4 weeks of vacation is huge. That's what the faculty get, and it never goes up. So they're getting exactly what we get. I had a question on how do you fight against the narrative that applicants are nervous because of the union activity, rather than that they're nervous because of the conditions that spawned the union activity?
Yeah, so this this comes up a lot. We understand for a lot of people that are coming in that if they're not familiar with how unions work and all this stuff, it can look like we have this really bad relationship. And we really remind people that the reason that we're doing all these actions and that we're pushing back is because we're all standing together in solidarity to fight for better working conditions. And it's really something, to aspire to. Like you should want to be at a residency program that's unionized, because you know that you have this group that truly has your back. We are not, there's nobody that is like pulling the strings for us. Like we're really just fighting for each other, and we don't have to worry about these like big donors and all these things. Like we are just there to make sure that residents get better benefits, and that they get paid a fair wage that is livable in Seattle. So it can be difficult, but we try to be just really positive with those people coming in, and we've made a really conscious effort this year to really up like our social media and all the stuff that people can see from afar. So if people hear these rumors that the union is like this big bad thing, we really try to kind of stop that and be like the union is just us, it's just residents. So we're just really here to help each other. And we've done a ton of, like, as the new class comes in, we get those questions too, and we've done a ton of like these kind of conversations with people where they can jump on and ask us questions, and we try to just make it be this like familiar thing.
Well, like you say you have 82% of the residents that are residents are in the union. So that says something about how they view the importance of being represented in their job.
Yeah.
So I think Cynthia was the next person.
Thanks. Yeah, I just had a couple of questions about about some of the things that you said. First, what's RFPA?
Oh yeah, so the RFPA is the Resident and Fellow Position Agreement. And essentially what it is before there was a union, UW had their own contract for residents that they had them sign, where they get to just pick all the rules and how, all the benefits and stuff like that. And then when we unionized, we got our own contract. That's the collective bargaining agreement. That's the thing that we bargain with them. So we have a say in it. We, don't sign off on it until we're ready. And so for whatever reason, UW has decided to keep this RFPA, even though our collective bargaining agreement actually supersedes it. And so we told people to not sign the RFPA until a collective bargaining agreement was mutually agreed on. It is more of a symbolic thing, but we're like, it's not fair that they get to have you sign this thing that you haven't had any voice in until we have the one that we all have a voice in actually decided upon. If that makes sense.
Oh, great to have a union organizer on your side. I was on the steering committee of SPHERA, and I learned so much from our union representative, and we were a CIU, and I didn't even know about CIR. I don't think, unless I'm just not remembering.
CIR is actually part of SEIU.
Right, I saw, but SEIU was like kind of a big sister to us. But I really support the idea of being independent now for just the reason that you brought up, the idea that people aren't feeling like they're being co-opted. I mean, there's a lot of bad PR that's been thrown around about unions, which is part of why we have so little of union representation. I think that It's Just Us is actually a great place to come from,
yeah.
especially when they're really smart people who know what they're doing, who can help.
Yeah, it's definitely, I would say, a learning experience for all of us. Just like I'm learning from them, they're learning from me. So
well, and it's great that there's such good resources to learn from. What's a review of systems boycott? I didn't understand what that was about.
Yeah, so if you're writing up a note after seeing a patient and you write down all the different things that you reviewed, so basically what UW often has people do is they have them indicate that they have done a full review of systems. So if somebody comes in and says like, my ankle is broken, like they don't need to test. I don't know, if somebody has like an ear infection or something, like that's not relevant to what they're doing. But UW will have people put in their billing stuff that they've done a full review. Which is kind of sketchy to begin with. So we told people to only put into the note the things they actually reviewed, which just means that the note is not billable at the highest level. So it potentially costs the university money, but it's money that they shouldn't have been billing in the first place.
Well, heck yeah, this university has had enough trouble with falsified claims.
Yeah, there's a history of this.
If the Housestaff are witnessing being, I am a community attending, and I have not seen that happen with our family medicine residents. It's the opposite. People are, in my experience, people are very careful about making sure that they can justify what they do. But if that's not happening, then they have every right to whistleblow on that, and the university would be in trouble. So it seems like more like
just a comment.
Point
Okay.
of.
Chris has another question.
Oh, no, sorry, you can finish. I just had a comment about that.
I was just going to say it's just more a point of legal principle than union action. I mean, if the residents are being asked to do something that's illegal, they'll be saving the university money in the long run if they refuse to do it. But it should be publicized that way, I would think, at least within the university.
Yeah, it's a tricky. I'm guessing that Chris has some comments about this because it's a tricky spot to be in.
Yeah, no, they should absolutely not ever be documenting anything they didn't do. That's not the way we teach it in our clinic. I have heard isolated incidents in certain other departments, which I won't mention, where they rotate through, where they're asked to do more review of systems and then document it, that are really unnecessary. And the review of systems strike, as I heard it, was actually that they would just leave it out, because unless it was relevant, whether they did it or not.
Yeah.
But yeah, they should never be doing anything documenting anything that they didn't do. I totally support the review systems strike. I totally support them, not ever documenting what they didn't do. But sometimes I've heard definitely in some rotations where their billing is way overemphasized and they're being pressured to document things, but to do things and then document things that are not totally necessary, to put it that way.
Yeah,
but it should definitely be reported if they are asked to do something they didn't document, something they didn't do.
There's a couple different ways to do it, and because we didn't end up going through with the action, we didn't get into that place. But it's tricky because like we talked about it with UW medicine leadership, and they're like, oh, we would never tell you to do that, but people, everybody has said it's the norm, and UW has a history of these kind of things in the past and have been investigated. So
yeah, I can only speak to our own department, where they're pretty anal about the compliance. Yeah. They're super worried about any other compliance problems like they've had before.
Okay, any other questions? Anyone on the phone? Kathleen, Steph, Merle?
What about the possibility of joining the King County Labor Council?
Yeah, so I'm glad that you brought that up. So we have talked about it. When I started, I went and met with them because we were kind of considering it. And we decided not to for a couple of reasons. One of which is that the police union was part of the county labor council, and they spent a lot of resources on getting their contracts through. And they also have been more moderate in their endorsements. So we felt like this last cycle that they really didn't make some of the endorsements that were as pro-labor as they should have been. And there's just a lot of kind of internal politics there that we have been not in agreement with. And then there's just also the added cost, but I think we're in a place now where we feel comfortable doing something like that. So the county labor council is actually voting tonight. They may have an answer I haven't seen yet about voting out the police union. So I think if that does happen, then we will probably sit down and have a conversation about it again, because it does allow a lot more resources that we could definitely use since there's only 2 of us on staff.
Sorry, just one more. I just want to follow up on that surveying the membership about support for Medicare for all. Because labor traditionally is very supportive, but physician organizations are traditionally terrible. But this is a good opportunity for some alignment. So if really common causes. So I think it would be amazing if you guys could look at that at all.
I personally am very much in support, and so I would like to see this happen as well. And we have, so obviously like the new people start on July 1st, or some of them are starting now. And so that also means that we have a board transition, that there's the outgoing board has overlap of this month, and the incoming board has an overlap of this month too. And so for the next board coming on, we have established a political advocacy group that will be focused on doing exactly these kind of things. So as soon as that group should be meeting, actually their first meeting next week. So once we've got them set up, we will definitely connect them and make sure that they start to have the conversations and that they can start doing polling and stuff like that. Because I would like to see us endorse that as well.
I wanted to thank Brenna for taking to your board the invitation to sign on to a letter to our congressional delegation for the Healthcare Emergency Guarantee Act, which you did. And would like to, you know, when you have the chance, explore with you more how your political action group, what did you call it?
We are calling it the political advocacy.
Political advocacy group. In Healthcare as a Human Right, we have a very good policy committee and would be interested in dialogue there to find out what common interests we may have and whether you might be interested in joining our effort, which PNHP is a founding member of Healthcare as a Human Right, been a core member from the beginning. And so it'd be lovely if that developed.
Yeah, I think like when we had this conversation before, I just see there being a lot of our work intersecting with the work that you guys all are doing. And so I think we would really like to get that going. So I will definitely connect the group and see that we start having those conversations so we can make that happen.
As well.
Any other questions?
Well, hearing none, was there other, are there other things that we were going to address tonight, or?
I just got one question.
Oh, okay.
Now that you're finished this arduous campaign to get a semi-decent contract, what is your next, what are you going to take on next?
So I joked to everybody that bargaining for the next contract started the day after we signed. So we are basically in a situation where we know that the only way we're going to get the contract that we really want is if we go on strike and we really like push hard on UW. So we are going to start buffing up our membership engagement dramatically and start talking about going on strike now with people. So they hopefully warm up to it in 2 years, because our contracts expired a year ago. So we are actually already a year into a 3-year-long contract. So we are going to be doing a ton of membership engagement and getting them just like more. We find that a lot of people don't even want to like say labor union. They just are like, oh, I'm a member of the association, but are even uncomfortable with that. So we're going to put a lot of pressure into our membership engagement, and then we're going to really pick up that political advocacy work too. And we are actually not eligible for interest arbitration. So that's one of the reasons we also wanted to get a contract before July 1st, is that the university could just unilaterally put the contract through on that day. So we're going to start working on some kind of lobbying to see if we can get the law changed around that, so we will be eligible for arbitration.
Brennan, did I understand you to say that you just signed a 3-year contract and you're now starting the 2nd year of it?
Yeah, will be July 1st, second year of it. So we don't have as much downtime as we would have hoped, but that's why we really got to work on that membership engagement stuff. So, all right. Well, if there's no more questions, I might hop off. But thank you all so much for having me talk at you guys. And if you have any questions or anything or ideas for things that we can partner on, please definitely reach out. And our email is just admin@uwha.com. It's at the end of the slides. And it's just Rico and I are the ones who, Rico's our other staff member. We're just the ones who are behind the email. So we're always happy to chat.
Okay, well, thank you so much, Brenna, for presenting that, a very important issue in today's climate.